is Betty Lou. I'm 4 years old. I would like to be a mechanic. The smoke makes me feel sick and I have to go to the doctor. I got 2 Spider-Man stickers. The green ones are mounted. And all that brown there, that's the dust.
There's a chunk of every summer that has some wildfire smoke in the air. As a child care provider, we have to monitor that and make sure that kids are only going outside when it's safe for them. My name is Marmot Snetzinger, and this is Little Twigs Child Care. As young as 2 years old, 2.5, we do a lot of talking about the weather. They understand that we can't go outside, it's not healthy for our lungs. But the younger kids, they just don't understand why we didn't take them out on a walk that day. So yeah, I think it kind of throws their whole schedule off.
Children's lungs don't stop developing until they're adults. And so when you're introducing a pollutant to those little developing lungs, you have the opportunity to make things worse than if they were fully developed. A lot of people in Montana now anticipate a wildfire smoke season. We can see smoke coming to western Montana from a huge part of the country and Canada. So even if we don't have fires locally, someone somewhere is going to catch on fire, and there's a good chance that smoke is going to make its way into western Montana. The wildfire smoke is essentially a chemical stew. There are literally hundreds of chemicals in wildfire smoke. What we're most concerned about are the really, really tiny particles in smoke that when you inhale them can bypass all your natural defenses, go really deep into your lung. It can even pass into your bloodstream. We have multiple studies out of California where they're seeing age groups admissions to hospitals for asthma-related complications during a smoke event. The greatest percentage of increase is in the very small children, 0 to 1 and 0 to 4, compared to if there wasn't smoke present. So you see like over 100% increase in the amount of kids going to the emergency department with asthma complications than if there had not been smoke.
We had a couple of babies that actually ended up in the hospital. One of them just ended up in the hospital for 2 days, this last big wave of smoke that we had. And they could see, they did a scan, and they could see that he definitely had some issues going on with his lungs from the smoke. Other kids have had just headaches, and it's been hard for them. They just feel headachy and don't feel good.
One of the most significant impacts from climate change on our wildfire seasons is just how long the seasons can last. When a fire starts, it's not going to go out until it snows. The potential for a smoke event that can drag on for weeks and months at a time is really a public health nightmare.
It's crazy making to try to find things for the kids to do and provide the space that they need to run around and get the exercise they need when we can't go outside.
It can be hard for kids to be inside when it's summer, and it can actually increase anxiety for parents. I'm Amy Sullenberg, and I'm the Executive Director at Climate Smart Missoula. So we're a local nonprofit. We work on all things climate change related, mitigation, adaptation, building a resilient community, and just building momentum for climate action. Research has really been in the last handful of years where people have realized that smoke comes indoors and that any little bit of air pollution matters. There's ways to actually clean our indoor air that aren't too expensive, that aren't impossible. We got some HEPA portable air cleaners or air purifiers. They're anywhere from 100 to many more hundreds of dollars. We did some testing, and basically they work. You can clean a room really pretty quickly by plugging it in for a couple hours and really reducing the amount of air pollution. So the people that have the means, we just recommend, hey, go out and get HEPA air filters. But we also recognize from the get-go that not every family or individual has the means to just purchase a HEPA air filter. So could we actually give them to folks that are most in need? We ended up having a little bit of funding to do that. Our community stepped in, and over the years when there have been bad smoke events or years where we're seeing a lot of wildfire smoke, we've accepted donations, and then we would give those out to folks. Along with the health department, we've realized that putting a filter and just duct taping it, connecting to a box fan is also a really effective way to clean the indoor air.
And that arrow is the airflow arrow. You want to put that on the back of the fan so that it's pointing towards the fan. And you want to just grab some tape, tape it right on.
And so that's been some of our programs too. With limited funds, we've been able to put together with, $25, $30, a box fan and a filter, and a lot of families can, come up with that money and have a filter that they can move around in their homes.
I've been preparing knowing that the wildfire smoke will be a part of our lives and a part of these kids' lives for a very long time. We started renovating the garage out back. It's got air filtration and a little bit of cooling, so when we have really bad days that they can go out there and still play. Climate Smart was one of the people that helped us get filters. And then I just, as an independent provider, decided that we really needed a larger space. And I haven't been able to find funding for that. So that retrofitting of the garage space for filtration was just an expense that I thought was really important to put money towards.
One of the things that our community is doing more and more of is helping people with the tools to be able to talk about climate change and how it affects our community, our families moving forward. So you get, youth in middle school and high school and university that are actually, really fearful about what their future is. I know for a lot of kids, it actually feels really good to be part of the solution of a problem they see. And that can happen with any age kids. Giving them an opportunity to grow their own food or reduce waste or get around on a bicycle and be part of climate solutions has everybody feeling better.
The big thing is to realize that this is a very long-range thing for them. Climate change is going to affect these kids a lot as far as just extreme climate. So whether it's drought and wildfire smoke or whether it's big storms that they have to deal with, not the availability of water, so it's definitely going to be affecting these kids. I raised a child here, and when she was young, I was worried about her lungs and the wildfire smoke, and things have only gotten worse as far as how much smoke we have in the summers. And for these kids, for the little babies, I know that if they're going to live in the West, this is going to be a lifetime of smoke, and so we're just the beginning. Their lives in these first 3 years are really, really important and what the foundation of their health is. And so I want to do everything I can to provide a healthy place for them.